we defined an activity restriction as simply the functional problems a patient discusses. So the things that they're having difficulty with doing. That can also have capabilities in those functional aspects of their life. And this is what's really important in our data collection, is that we don't only explore what a person's having difficulty with or what aggravates their problem, but we also find out what their capabilities are. That's part of fully understanding the person's experience. Where participation, as we talked about in Module 1, refers to how that affects the individual's ability to participate in different aspects of their life, their work, their family life, their activities of daily living, their social life. And again, not only finding what they're having difficulties with in participating, but what are their capabilities. Now, when you think about where this information comes from, in all categories of clinical judgment, we don't get the information from one single part of our assessment or examination. In fact, we get clues throughout the whole examination. And it's worth thinking about where the clues come from so that you're aware of that and alert to that information when it occurs. So, for example, information about the activity and participation, it often comes out very early when the patient's telling us what their main problem is, where they include with that the difficulties they're having in some activity or their inability to participate in something. So it may be almost their first answer to the question we ask about their main problem. The area that particularly targets this category of judgment is the behavior of symptoms. So when we explicitly question about what aggravates and what eases their problem, how it varies over 24 hours, then we are screening essentially the things they're having difficulty with. And it's important to find out the main things the patient reports on, but it's also important to screen beyond those main things to see if there are any other restrictions in activity or participation. The other area that you often get some clues, and sometimes you pick up things that didn't come out in the behavior, is in the history. Because when the patient gives us the history of their problem, they often talk about the difficulties they had when it first started, either the first episode or the beginning of this problem, and then they talk about how that's changed over time, either as the problem progresses or different episodes, and they refer to difficulties they've had in the beginning compared to difficulties and capabilities they have now. And lastly, when we use disability questionnaires, which are very useful semi-objective measures that we can use in reassessment, they specifically target activity and participation.